welcome all to today's offering. This is Diana Arias with the Community Technical Assistance Center at NYU's McSilver Institute. And for part two of our two-part clinical intensive trauma-responsive telehealth for children, adolescents, and their families with Dr. Ritchie Rubio. So hopefully a lot of you are all folks that joined us the first time around and can build from that first part. Dr. Rubio is currently the Director of Practice Improvement and Analytics of the Children, Youth, and Family Systems of Care at the San Francisco Department of Public Health in California. In the previous offering, we ended with Dr. Ritchie Rubio sharing more of a homework of sorts, right? Really giving you an opportunity to take some of the resources that he shared and to really apply it for use when working with children or youth or families via telehealth. So before we get started and to orient us, on the following slide, I do just want to introduce poll questions that we have. You will be seeing about 5 poll questions pop up at once on your screen. When you see that, if you can take the time to fill out those poll questions, that would be greatly appreciated, as it would help to guide us for the remainder of today's presentation. So it should have popped up now. If you can complete those as you go through each of those 5 questions, and we'll leave it on screen for just a little bit. If anyone has any issues, please chat in and let us know. And we are seeing some folks reply. So again, we'll leave it up for a little bit. So thank you so much. I see some folks filling it out. Thank you. All right. I know there's a couple of questions there, so apologies. And while we have this up, Ritchie, I'm thinking maybe you can talk a little bit about the agenda. We will need a little bit of time to generate those questions, the results for those questions, as there are 5 questions here. But I'm figuring maybe at this point, Ritchie, I can turn it over to you, and within a slide or two, we can ideally come back and revisit that. But we're going to leave the poll open for a little bit longer for folks, because there are a couple of questions there. How does that sound, Ritchie?
That sounds good. Thank you so much, Diana, and thanks for the introduction too. So welcome again, everyone, and good morning. And while you are completing the polls, and of course, Leslie will also help me in terms of like aggregating the results and then showing the results in a little bit. Let me just walk through the agenda for today. So we'll get a chance to review the results from the poll, and at the same time, open the floor really to you, just for any question, any feedback, any sharing, just in terms of the successes or potential like barriers or opportunities you've had in the implementation or the use of the telehealth tools that I walk you through during part 1. So we'll spend like a couple minutes doing that in the beginning. And after that, I will continue the discussion from last time around the different triphasic trauma responsive interventions when working with clients who have been trauma exposed. And the first phase is really around safety and stabilization. So I will continue talking more about some tools and some principles you could use in supporting safety and stabilization of your clients. After that, I would launch into phase 2 of trauma focus or trauma responsive care or treatment in terms of the trauma narrative processing, again, highlighting a couple of telehealth tools you could use when you are now in that process or that phase in working with clients in terms of really facilitating a conversation or processing of their trauma narratives. After that, I would just want to highlight like a couple of evidence-based treatments or practices that potentially really work with clients, especially children, youth, and adolescents and their families, and focus on what are teleadapted tools you could use to supplement your work around evidence-based practices. After that, I will open again the floor for discussion, Q&A. Again, throughout this training, feel free to put your questions in the chat, and then we will aggregate it, or Leslie will help me aggregate it, and Diana too, in terms of looking for themes that I potentially could address towards the end of this 2-hour session.
Yes, thank you so much, Ritchie. So I don't know if you have access to results, but I can quickly walk through those. Of the folks that answered, we have about a split, sort of almost 50-50 in terms of the first question. Were you able to implement one or two of the trauma responsive tools with at least one client in your telehealth work? 50% said yes, 48% said no. For those of you that said yes, it seems that the one that was utilized the most was the ACEs screening tools, followed by the ACEs education and resilient questionnaire. For those who were not able to implement, let me just get a chance here. For those who were not able to implement this, currently do not have enough clients and had not been relevant or clinically appropriate to implement. And if you used at least one of the trauma responsive tools, did you experience any challenges? So for those that applied, there really weren't that many challenges. The few that were shared where I did not have sufficient time to properly implement, client was not interested or engaged. And then we did have other. So I'd be interested in what those others are. So as Ritchie said, please feel free to share anything else along in the chat box, and we will curate those and probably have a Q&A later on. But yeah, so thank you so much for sharing that.
Wonderful. Thanks, Diana. And also thanks to everyone who have participated in the poll. And it's great really to see, even with the split, I also know it might not have been enough time between part 1 and part 2 to really implement some of the tools that we walk through. So I encourage you have a copy of the implementation plan, continue doing that, especially if you have clients that you're really meeting via telehealth, to really find like 1 or 2 tools in the next few weeks to really find ways to integrate that into your practice. Now, in terms of those who responded, yes, they have used some of the tools in telehealth sessions with their clients. I appreciate that many of you really explored the use of the ACEs screening tools. Again, there are a couple of them. There are the more traditional ones that really highlight the use of the 10 traditional adverse childhood experiences, but I would, of course, always encourage you to use other tools as well that would capture adverse community environments, and also balance it with really using like the resilience questionnaire, which I see like a couple of you have also like used that. I think I mentioned last time about the Telio platform, which is really a wonderful platform. For me, it's like an amazing platform as a good alternative to Zoom, because built in there are already tools that you could just upload to sessions with clients that they could use, worksheets, videos they could watch around like mindfulness or stabilization, audios that they could listen to help them around mindfulness practice, etc. So feel free to explore the Telio platform if you can. Telio is free, so it just requires you to subscribe to the platform. And then after that, they have a technical or robust technical support. You could feel free to also reach out to them if you want some help walking through the platform so you could effectively use it with your clients. Yeah, let me see like a couple more that was mentioned. For those who were not able to implement a trauma responsive tool in telehealth, do not currently have any clients. For some of you, you responded not applicable, and there was also an option to answer other. I guess I just want to open the floor if there's anybody in the group right now, 1 or 2, who might want to share any barriers or opportunities that open up for you in terms of implementing any trauma responsive tool, from part 1 that, you might want to share to the group. So feel free to do that as well. Feel free to include it in the chat, or you could also unmute yourself or raise your hand if anybody wants to share their experience. Let me scroll through the chat too. A second.
Yes, so the only thing that I've seen come in terms of barriers, it's cancellation of virtual services, which clearly also comes up, I think, for in-person. So ideally, moving to telehealth, there's a little bit less of cancellation, but obviously there are cancellations as well on telehealth. So yeah, I mean, if there's anything else that you want to share, again, please feel free to do so via the chat box. We can field those questions. But I certainly encourage you to take the opportunity now. If there's anything that you want to check in with Dr. Rubio based on his experience, knowledge base, and expertise in terms of running these assessments via telehealth, please share now. All
Thanks,
right.
Jeremy, for sharing that. Are applicable within a virtual case management? Yes, definitely. They are very useful. And also, when you think about like virtual, I think sometimes there's the idea that, okay, with telehealth, I have all these tools that I could use solely for telehealth. And then if I'm doing in-person work, I have other tools that I use solely for in-person. But the reality is you could have a hybrid model of using it. Like, for example, for me, when I'm meeting now with clients in person, I give them the option sometimes to either engage in clinical material using tactile actual tools, or if they want to do it digitally. So, like within an in person setting, then would have like a laptop or like an iPad or even like my phone, where during an in person client session, I give them the option to use some apps or to use some games that are mental health informed in the computer or on the iPad. I would walk you through some other tools today, but one of those that I use a lot is Sandtray. So even in the use of Sandtray, I give my clients the option. For example, would you want to use the Sandtray using actual sand and miniatures, or do you want to use a digital platform of like a Sandtray? And I remember one time, a couple months ago, I had a client who had OCD as a presentation, and one of the presentation is around really anxiety around like dirt and cleanliness and obsessions around like cleanliness. So engaging in an actual sand tray was difficult for this client, but giving that client the option to, how about we do sand tray using a computer but on a digital platform of like a sand tray? The client was more engaged to do that, especially in the beginning. And of course, part of the process is to get them to being more comfortable using the actual sand later on. But as a preliminary way of really engaging that client in Sandtray, we use like a digital Sandtray version, which I will show in a little bit, like what would that look like. Okay. If there are no other questions, I don't see anything in the chat, any other sharings. But again, feel free to share your experience or any questions you've had around telehealth or the implementation of some of the tools in the chat, and I will address them towards the end. But just in terms of time, because it's already 7:15, and I also wanted to really honor your time. I'm going now to launch my slides, and we are going to go into our topic for this morning. Okay. So this is just a reminder. So last time during part one, I shared a case, and this was the story of Leanne. And with that case, I shared that really in case conceptualization, it's good to use some metaphors to really help us understand what's going on with the client. And I used the iceberg metaphor to really highlight that, given a lot of things going on in the story of my, sorry, it was my, we have to think about really what's at the tip of the iceberg and finding ways to really also address, in our case, conceptualization and treatment, what's going underneath or below the waterline. And I introduced the concept of when we think about ways to make our practices trauma informed, it's good to really anchor interventions or thoughts about interventions around evidence-based practice. And that is really an effective balance between looking at the research evidence, but also really highlighting clinical expertise, and also in a trauma-informed lens, highlighting that the clients are also experts and their expertise around their own cultural background should be leveraged when we are thinking about like interventions. And that should prompt us to really this effective balance among being culturally competent through consistent cultural adaptations in the work that we do, but also being culturally humble and curious about our clients' cultural background, being culturally aware and sensitive. So last time, when we think about trauma responsive care and we are thinking about like treatment, we have to subscribe by certain models. One of them is the one by Judith Herman in terms of the triphasic model. And last time I introduced you in terms of certain activities or interventions that you could use to help clients around safety or stabilization. We'll continue on that today. And then towards the end, we'll talk more about the trauma narrative processing, which is really phase 2 of this triphasic model. This is also a good reminder from Bruce Perry. And for me, it's a more accessible way of thinking about the neurosequential process in the brain in terms of many times for clients who are dysregulated, who have trauma exposures, right? It's hard to really process information and the trauma memory in the cortex or the executive functions of the brain. That means appealing to reason immediately. And a more meaningful approach is to do a bottom-up processing with a client, wherein we start really with regulating their body functions and their emotions, moving to relating with them better or improving their relationships with their support system before we appeal to reason. And last time, in terms of helping them around like regulation, we really start with safety and stabilization, which really is helping clients be more regulated in their brainstem or their hindbrain to make them or help them be more physically and emotionally calm and settled. And part of that is helping them around somatic management. I gave a couple of recommendations around breathing exercises, relaxation, integrating like mindfulness exercises, grounding, which is very important, especially in like trauma work. And then also looking at ways to really support clients around emotion regulation. Today, we'll continue the presentation around safety and stabilization, but I wanted to highlight another way of helping clients around safety and stabilization is around cognitive coping, helping them really regulate their ways of thinking about themselves, their future, and also about their own experiences. Many times, if you're subscribing by a theoretical orientation of CBT or cognitive theory, what really contributes to presentations of clients might be certain maladaptive thoughts or distorted thoughts. And the way cognitive therapy works is finding ways to really facilitate a conversation with clients around those distorted thoughts, help them replace them, challenge them in a way that they would be able to derive more adaptive thinking processes. And part of that is really teaching clients the CBT model, right? The thoughts, feelings, and behaviors are interrelated through this cognitive triangle wherein they really impact or influence each other. So certain behaviors happen, like a client behaves with an anger outburst, for example. Sometimes they are motivated by certain thoughts. So for example, the thinking that, oh, nobody likes me. And so that can contribute to feelings of like anger or sadness about oneself. And the behavior that could ensue could be an anger outburst. So you could see here the interconnections among the three. And many times when you're working with children and adolescents, if you're starting with like the CBT triangle, you could have various ways of really having that conversation with clients. You might use like worksheets, right? Wherein you have there the drawing of the CBT triangle and then walk them through it. With younger kids, sometimes using worksheets like that might be not as engaging. So I would recommend really finding creative ways to talk to clients about that CBD triangle. I've used sand trays a lot, and asking clients to even like choose miniatures to represent thoughts, feelings, and also like behaviors. So you could see like a couple examples here. You also see here, especially when I work with younger kids, the use of puppets could be very effective. One of my favorite puppets is this one. And it's a three-headed dragon puppet. And I'll show this to you. And in this three-headed dragon, it's a good reinforcement to clients that, okay, you have here one dragon, but in here, I have three heads of the dragon, and each of the heads represent different things. This is the thinking head. So this is the head of the dragon that thinks a lot. This is the feeling head of the dragon. That means this is the dragon that feels or experiences all the emotions. And then you have the behaving or the acting dragon. So this is a wonderful way of really being creative and really thinking about this is right there, the CBT triangle for a very young client. And even in a telehealth session, if you have the dragon with you, you could use this instead of like a worksheet to talk to clients about, so how is that dragon feeling now? How is that dragon thinking? What did the dragon think about that experience? Or what do you think will that dragon do in terms of like behaving based on what they're thinking and feeling at that moment? So you could use this as a creative way of thinking about that CBT triangle. Okay. Let me bring back my slides. So you could have also other ways of creatively doing that. I would recommend looking at the work of Athena Drews in terms of really integrating play therapy into CBT work that you do. You could use other metaphors. You show what you see there is, for example, the CBT baseball. A diamond could also be a good alternative to the CBT triangle. Another way of doing it, even in a virtual way, is to play with clients. Have a movement-based activity that you see them in the screen. You could send them materials in the mail, or you could ask them to create materials with their parents or caregivers. And then you could create for them on the floor or in the room where they are in, like a CBT triangle. I would recommend following the work of Liana Lewinstein. So her name is in the slides, and you could go to her website. She also has a YouTube channel where she provides like creative ways of really bringing CBT to clients. And here's an example of a game or a movement-based way of teaching kids the CBT triangle.
We're going to play the helpful thoughts game to help us learn how unhelpful thoughts can make us feel worse and have a negative effect on what we do, and how helpful thoughts can help us cope better with situations. I'd like you to pick an unhelpful thoughts card. That's the blue deck of cards. So pick the top card from the blue deck of cards and read the situation out loud.
You wake up from a scary dream.
Okay, now stand at the top corner of the triangle where it says thoughts. So the situation is you wake up from a scary dream. Now read what it says for the unhelpful thought.
The monster is going to eat me.
Okay, so you're thinking to yourself, you wake up from a scary dream and your thought is, the monster's going to eat me. Now hop on your left foot to where it says feelings. And read what your feelings would be in this situation.
Scared and unsafe.
Scared and unsafe. Now hop on over to behaviors. And then what would that thought and those feelings, what would that make you do?
My heart is pounding fast. I would be crying and running to my parents' bed.
Right. We're going to play the helpful thought.
So you could see there just a very quick example. I did not play the entire video. You could look for it too in the YouTube channel of like Liana Lewinstein. But it gives there an example about, especially in a virtual setting, it's not enough to just have like a digital worksheet. To really keep a client, especially a young client, engaged, you can create like a movement-based like exercise to teach them like the CBT triangle. By walking around, you could be creative in also asking them to do other types of movements, hop like a frog, from the thoughts card to the emotions card to the behavior card, as they are talking about, examples. Or you could also ask them to think about their own experiences in terms of what those experiences brings to them in terms of like thoughts, feelings, and behaviors. I've seen the chat sent to me like privately, and thank you for sharing that. Like creating or developing a superhero alter ego that speaks to a superpower they would want or feel connected to has helped clients to feel empowered, and this exercise can be built on over time and explored further. That's wonderful, especially when you're thinking about even like CBT work, right? Really thinking about like a super ego in terms of what would that superhero alter ego say about what you're thinking about. I'm unlovable, or I'm not able to do this. I would always be a failure, right? And to think about like alternative ways of really replacing like maladaptive thoughts. It's a wonderful creative way of really including like a superhero alter ego to help with that, the client, in terms of like challenging those maladaptive thoughts. Thanks for sharing that. Also, digitally, if a client of yours is very engaged in using apps, if they have phones or they have other devices at home, they could download an app that was created by the trauma-focused CBT intervention called Triangle of Life. And you could easily find the Triangle of Life in their website to learn more about it. It's a free app. So you could also download it on your phone or an iPad or even on a computer. And you could use this to help clients around the CBT triangle. I'll show here like an example of how I do it with a client, not a real client, just a volunteer child, a family member who volunteered to do this with me. But in here, we are looking at the app together and playing with the app together. And in here, it walks you through a story in savannas in Africa that gives you a story and prompts kids to really respond to make that distinction between thoughts, feelings, and behavior. So here's an example, very quick one.
Okay, I wonder what line we'll do now next.
That up ahead. Try tapping it to see what it does.
Oh, okay. I was lonely. Do you think that's a thought, a feeling, or a behavior?
Feeling.
A feeling, very good. Oh, let's tap this other one. I shouted. Is that a thought, a feeling, or a behavior?
Behavior.
Behavior. Let's try the last one. I was happy. Is that a thought, a behavior, or a feeling?
Feeling.
Yep, that's a feeling.
Okay. I'm just showing that as an example. You could explore the app on your free time and see if that is potentially also another alternative digital way of really teaching kids and even like teenagers that you work with the CBT triangle. So part of cognitive coping after you have helped clients with that psychoeducation piece in terms of really learning the interconnection or the relationship among thoughts, feelings, or behaviors, now you can move to like cognitive restructuring, helping them challenge, find evidence against or for some of their maladaptive thoughts, and then help them towards replacing those maladaptive thoughts. And you could do various ways of really doing that. Part of it, of cognitive restructuring, is helping them understand sometimes there are themes in the way we think. And so many times we can have like categories of like cognitive errors or maladaptive thought patterns. With younger kids, you might use like metaphors to help them understand those different like categories. One that I use is this concept of ANTS, which stands for automatic negative thoughts. And if you Google like automatic negative thoughts with ants in it, you would find different like visuals that really talk about different categories of ants. The can't ant, like every time a client, is about to enter or do an activity, they're like, I can't do it. I'm not able to do it. So you can talk about the can't ant, right? Or you could have the blame or the victim ant, always thinking that anything that happens to them is my fault. Using a trauma informed lens, you could see this pattern a lot too if you're working with trauma exposed clients, right? With traumas that they are exposed to or experience, many times they could have this maladaptive thought that it happened to me because of me, of things I'm doing. I'm a bad kid, so all those traumas happen to me. So there's the blame or the victim ant that you could use to really show them those patterns. So you could use ants, and there are links in your slide, which will be sent to you later on where to explore these visuals that in a digital session with a client, you could show them these various like visuals of the ants and help them categorize different themes that come up for them when they have this automatic negative thoughts. Another one, you could use NATS. And this is an app that was created in Britain called Pesky Nats. It's a CBT informed app to help kids and also adolescents to really, really process their maladaptive thoughts, to find out what are the categories of those thoughts. And the categorization really helps them understand those patterns. And that could be your target for then helping them around the replacement or restructuring. For teenagers, you might also help them use like avatars. And this one was created by Trauma Focus CBT. It's called the What Are You Thinking team. And the link is in your slide. It's the use of avatars wherein they personified certain cognitive errors, like the use of should. I should do this should not happen to me, or catastrophizing, whatever I do, bad things happen. And they use like avatars to represent those different cognitive errors, like catastrophizing is drama queen Jean, should statements is should a Sharonda, etc. And for teenagers, this could be a fun way of really thinking about categories of those cognitive errors. In case you're also wondering, where else could I find this actual like avatars? Let me put it in the chat too. I think this was shared to you last time in terms of the website I created to really support in-person and telehealth work. And if you go to that website, let me share my screen. Let me walk you through where exactly to find that resource. There is a section in the website on CBT informed tools. And if you scroll to it, I organized it based on John Weiss and Sarah Bierman's categorization of principle-guided psychotherapy around tools to help clients around feeling calm, increasing motivation, repairing thoughts, solving problems, and trying the opposite. Now, in terms of cognitive coping, there's a section on repairing thoughts. If you click on that, you would find there resources that you could use digitally with clients, screen share, similar to what I'm doing with you, around using the CBT triangle. And you could help clients really understand it, doing psychoeducation work around them using those worksheets. Or when you get into categorization of thinking errors, there are a couple of worksheets there that you could use. And one of them is the one created by Trauma Focus CBT on What Are You Thinking team. And it looks something like this. You could increase it a little bit for clients or zoom in. So, and then you could walk them through it. Similar to what I'm doing with you right now. If you're in a telehealth session, you could just walk through clients through it and then talk about each of them, whether it applies to their experience or not. Okay. And going back to the slides, of course, after you have helped them around categorization, then the work of cognitive restructuring, you could have various ways of doing that. Worksheets in CBT have been created to help clients really narrow down on those cognitive errors, also those maladaptive thoughts or automatic negative thoughts, and help them through a process of trying to think about the evidence, but also helping them think about how do you replace that thought so that you would feel better about yourself and it leads more to more adaptive behaviors. For younger kids, you might use this resource. For older kids, you might use the traditional repairing thoughts thought record, right? In terms of, a column-based way using a table to think about like alternative thoughts. Or for kids and adolescents who are more savvy about the use of apps and they would sometimes prefer to use that, you could use apps that are out there. Happy Five, for example, is a good program wherein they have actual sections in their platform wherein you could do some CBT work about coming up with alternatives about their thoughts. Or here's a program created in Australia called Mood Gym. It was intentionally meant for really adults and also older adolescents to think about, to use CBT to process some depressive or anxiety related like thoughts. And they call them like warp thoughts, and finding ways to really find out what category or what type of thinking it is, but at the same time, walking them through an interactive way of finding alternatives to those warp thoughts. I also know that many times clients might not be ready to replace their thoughts, right? Or even challenge them. And sometimes when you even think about deep-seated thoughts that already form like cognitive schemas that clients hold about themselves. So for example, I'm unlovable or I'm not able, right? Those could be like schemas that clients may hold about themselves. Sometimes they're not ready to replace them. So an alternative way of really addressing them might be helping them not to be distressed by those thoughts, and also help them try to almost mute those thoughts so they are just in the background and they don't necessarily like impact them severely or more intensively. And this is a growing movement around acceptance, right? So there are different like interventions that would support like acceptance. One of them is DBT, or dialectical behavior therapy, wherein if clients are not ready for change, you might think about interventions first that really reinforce acceptance. Another is ACT. So of course, in the ACT model, acceptance is already a big part of that. So it's acceptance and commitment like therapy. Wherein in ACT, for example, they reinforce the use of cognitive diffusion, right? So if clients are not ready to change their thoughts or maladaptive thoughts, you might start with cognitive diffusion. And that is really a process wherein you would try to find alternative ways on how clients relate to those thoughts. So they diffuse from them in a way that it doesn't impact them as much. They're still there. They haven't been replaced or they haven't been changed, but in a way that they're almost like just in the background and not in the foreground of their lives, so that they are not impacted in their functioning. So a lot of interventions you could use around that could be like mindfulness, right? So if you have like maladaptive or like automatic negative thoughts, think about them, but just describe in your mind what they are without engaging with them, without judging yourself about them. And then look at them like, they are just leaves on a stream, and then letting them go. So as you imagine or visualize certain thoughts, put them on a leaf, and like in leaves on a stream, just watch them like go, right? Or you could also use like a conveyor belt, right? Think about a conveyor belt, and then as those thoughts come up, I want you to put those thoughts in the conveyor belt and then just watch them go away. Or you could use radio, doom and gloom, right? Think about those thoughts like you're hearing them from like a radio, and you could encourage clients to, try to mute them in your mind, right? So as you're hearing those thoughts, at first, probably they can be so loud and they are distracting you a lot. They are not helping you with your focus. But now I want you to think about like in a radio, there is like a volume control. Now I want you to turn down the volume of those thoughts so that they're almost like silent, or they're just like a whisper in your mind now. So finding like alternative ways for clients to really diffuse from those really impairing like cognitive thoughts could be an alternative way to do it. Donna also mentioned, can MI be integrated in this? Of course, definitely. Like motivational interviewing has a lot of principles that you could integrate even like in CBT work with clients. Here's another example. If you go to the YouTube channel of like ACT with Ross Harris, you could find like videos there that helps with cognitive diffusion. One of them that I use a lot with clients, I would screen share, show them this video, is to visualize their thoughts or even like intense emotions as being on a sushi train. And all they have to do is not grab into those thoughts or really focus on them or even those emotions, but just watch them go by and just describe them in your mind. So let me play the video just to show you what it might look like in terms of using this metaphor of like a sushi train.
So imagine that you're sitting in front of a sushi train at one of those Japanese restaurants, and there are all these dishes going past on the train. And in the center, there is the chef creating all of these dishes. The chef is like your mind, and the dishes are like all of those thoughts, ideas, memories that keep cropping up, coming and going all day long. Some of the dishes on that sushi train may be very appealing. Some of the stuff on that sushi train may be unappealing.
Like ants or maladaptive
And some of
thoughts.
it may be neutral, and take it or leave it. And it's much the same with our thoughts, memories, ideas that pop up throughout the day. Some of them are very pleasant, we really like them, we want to hold on to them. Some of them are very unpleasant and we just want to turn away from them, get rid of them. And a lot of them are kind of neutral, they're neither positive nor negative. So all day long, the sushi chef of our mind is creating all these different dishes, and the train keeps carrying them round and round. These thoughts keep cropping up throughout the day. Now we can learn to step back and watch our thoughts coming and going in much the same way that we can step back and watch that sushi train.
Okay, I won't play the entire video. You could look for it in YouTube as well in terms of this sushi train metaphor, but it gives this idea of like cognitive diffusion, right? Instead of really fusing with those maladaptive thoughts, just imagine like a sushi train and then just watch them go by without overly fixating on them or overly focusing on them. Other ways you could do like cognitive diffusion, I just give here like some options that I often use with clients. I use like a mini paper shredder. So if you're in a virtual session, you could write it for your clients too. Just, write their cognitive thoughts on like pieces of paper and then show them the ritual of like, now I want you to diffuse from it. And let's imagine that we are shredding those thoughts away, and you could use like, you could put a piece of paper on a shredder and then just, show them how you are shredding it, right? And they could do it if you are able to in your program as well. Mini shredders are cheap to purchase. You could even send one to your client as a gift, and they could use it as a ritual for themselves in terms of, if there are thoughts that are always like pestering them or they're always in their mind, they could, imagine or create a ritual for themselves, like actually shredding those thoughts away. Again, as a way to like diffuse from them. Or you could use other, in Guatemala, for example, there's this worry people or worry dolls. We're in creating a ritual of like, okay, I want to transfer all those thoughts now to these worry dolls and let them worry about it, or there's worry people. And now it's their turn to worry about it. This is especially very helpful based on this practice at night and during bedtime, especially when kids are not able to fall asleep because of all these automatic negative thoughts. So part of the ritual is that before going to bed, they try to imagine or visualize that they are transferring those thoughts or whispering those automatic negative thoughts to these worry people or worry dolls, and then tuck them away under their pillow or elsewhere. And now it's for them to worry about, not me anymore. So it's just a ritual of really that diffusion. You could use a flying wish paper, write it down, create like a practice of like a flying. You could use a Buddha board And that's another beautiful way of, clients can write on the Buddha board and then watch it disappear as a way of, once you see it disappear, I want you to just let go of those thoughts, right? So it's another way of like doing it um, with clients. So what I'll do right now is ask you to practice a little bit on this, but you'll do it like individually. I'm going to share to you a platform similar to this Buddha board. It's called Mindful Draw, which is created by Dr. Karen Fried and her team. And with this one, I want you to think about right now, do you have certain thoughts, potentially negative automatic thoughts that keep coming up for you at this time that you are in this training, right? It could be something you have to do around work. It could be something that was left over from stuff you've been doing the whole week, right? That for you right now is a negative automatic thought that you cannot easily just push away. And what I want you to do, I'm going to share this platform with you, is I want you to go to this platform right now, and you are going to just write down certain automatic negative thoughts that you have that you want to let go. Or if you want to symbolize them, feel free to do that. You could draw. You could also symbolize or draw figures to represent those thoughts. And we'll spend like around like 3 minutes, just a moment of grounding yourself like mindfully using this program. There you go. And let me screen share again, just to bring you exactly to that website. If you go there, you will reach here. There are settings here if you want to change them. Like, oh, I want to change the brush size. I want a different color. I could use like this color, this purple, for example. And then once you go there, you could write anything. Any negative or automatic negative thought, you could write it in there, and within a few seconds, you would notice that it goes away. And in here, I want you to have that cognitive diffusion practice of, as you're watching that negative thought disappear that you wrote or symbolize, I want you to imagine that it's also going away and just let it go at the moment. So let's spend like 2-3 minutes for you to just engage in that digital exercise of cognitive diffusion, of like mindfully writing or drawing and letting go of that writing or drawing that represents some of your negative automatic thoughts or automatic negative thoughts or ants. Let's give you all 1 more minute. Hopefully you're continuing to use that tool. This is a practice for yourself in terms of just that letting go. All right, so please continue using that even like throughout, if there are certain things that are distracting you from really focusing on this training this morning, feel free to launch that mindful draw and just find ways to just let go or let go of those thoughts. Yeah, thanks for the sharing in the chat too about in terms of safety and stabilization, using the singing bowl sound, as a way to really center or ground yourself. I think for traumatized clients, that is a very grounding way of really helping them around mindfulness as well. Wonderful. Thanks for sharing that, Diana, too, in terms of the use of like on-screen activities to make it really more engaging. Yeah, and especially those who are visually inclined. Yeah, and it's a different way as well of really improving the focus of kids and also like adolescents, especially in using like telehealth with clients. Okay. Let me share another digital platform. So there's is called Camp Cope a Lot. It's a paid program, but I think it's worth the investment, especially if you could see potentially using this for many clients. Camp Cope a Lot is a digital platform or an application and a website, a site that supports Coping Cat, which is an evidence-based treatment for anxiety, especially with young kids. Now, Camp Cope a Lot could be used for young kids, middle school kids. Some of them, especially the younger ones, could also find this very engaging. Adolescents, probably not a lot, but it's a good way of doing it via telehealth. And with Camp Cope a Lot, it really the visualization here is it simulates that the kids are entering like a digital camp. And then with it walks them through the different skills of like CBT to help them around like anxiety. It comes with digital manuals and worksheets. The camp looks something like this, right? And then in here, let me go to the site itself. It walks you through different parts of the camp, the waterfall to help them around relaxation, the totem pole forest to help them around the fear ladder, to create for them like steps on exposure to help them approach something that is very anxiety provoking for them, like some of their fears. Like if they fear like public speaking, what are some small steps they could use to really improve their comfort around public speaking? And then here you would find here a bulletin board wherein it walks them through 12 sessions, but of course, we know ideally you would have more sessions, right, to really strengthen the different skills that you walk clients to. So, 12 sessions, but ideally really more sessions than that teaches them each session, each of the skills around like CBT for anxiety, around like relaxation, cognitive coping, exposure, etc. You have here the workbook, and it's digital as well. So for example, let me click one worksheet in here, which teaches them about cognitive coping, right? So in here, really challenging yourself. It uses the fear model. Fear is feeling frightened is the first stage. We're in really acknowledging what parts of your body are anxious when you are frightened or when you have fears. Do you sweat? Do you have your heart racing, etc.? Expecting bad things to happen. This is really the essence of automatic negative thoughts. Like you have this expectation that bad things happen, right? That's why you have all those fears. So it's really capturing those cognitive errors or automatic negative thoughts, and then attitudes and actions that can help. So this is really the cognitive processing piece. How do you challenge those action thoughts through questions? And what is your problem solving step to help you replace those thoughts? So it walks you through that. And in here, in the different activities, for example, from the bulletin board, it models for clients how to go about it. It shares to them like stories that you could watch videos together to really learn these different skills of CBT. I'll give one example. So for example, in level 6, when you are reinforcing this cognitive coping. Here's like one video. Forward it.
What have you been eating?
I bet you couldn't sleep without your blankie, being away from Mom and out here in the woods and all.
Shush. Seriously, things okay here? Are you
Play the
feeling
video
all right?
quickly or short.
Don't you want to come home?
Do I want to go home? Well, I remember the roller coaster. First I was scared. But I figured out that I was just feeling frightened, and it was a false alarm.
That's the feeling frightened of the fear model.
Then I rode the roller coaster, and it was really fun. When I was practicing for the talent show, I was really worried about messing up. But then I figured out that if I'm expecting bad things to happen, I can use coping thoughts. I can't believe I did that dance, and it was pretty fun. When I was nervous about getting over the wall, I figured out that when I'm feeling frightened or expecting bad things to happen, there are attitudes and actions that can help. I can challenge my anxious thoughts, use coping thoughts, and use the problem-solving steps. It felt pretty good to make it over that wall.
Okay, so I'll just play that, but you could see here how certain ways of walking clients through a story so that they get the model and then shows some modeling on how it's done. So in here you see an animation, but if you go through the website, you would find other videos that show actual kids doing the different skills of CBT. And that, for me, it's a very effective way of really modeling, especially for young kids, how to actually use or do those CBT skills. Okay. And the rest in your slides would show other examples on how to use like Camp Cope a lot. I also included there other like game-like or video game-like forms of doing CBT work. Luminova is one called Tales of Courage on how to address anxiety. Mindlight is another. And with Mindlight, they have some free aspects of their program that you could already immediately use with clients as well. So again, it's a CBT-based program to help kids around like cognitive coping. And I would draw your attention again to the TIPS website. And I put the link in the chat that will be shared to you as well after this offering, which includes there a section on cognitive coping. So you go to the section on CBT informed tools, and there's a whole section there on cognitive coping, on repairing thoughts. Now, I also know that you work with diverse clients, so it's also good to be very culturally responsive in the work that you do. So there's a section there on culturally responsive practice. So for example, if you're working with Black or African American clients, you click on that, you would find their intervention resources of cultural adaptations of some CBT, DBT, or even trauma-focused CBT types of interventions. One of them under trauma-focused CBT is the one by Aisha Metzger, who really integrated racial socialization into the work of trauma-focused CBT with Black or African-American children and youth. And she has there really wonderful digital worksheets that you could already integrate with clients. For example, I was talking about cognitive errors. She has a way of really using that with cognitive distortion alter egos that has African-American avatars or characters. And she relates this to experiences of microaggression or even like racism in terms of clients thinking around it, right? Black and white thinking around it, personalization, like things that happen to me are my fault. Or in here, when something bad happens to me, like a racist experience or I was the target of a microaggression, right? It's never going to stop. It's always going to happen to me wherever because I'm Black or African American. Yeah. So you could use this as a way of really that cognitive processing with clients. Okay. So now let's move to the next section. There in the slides are just other tools you could use around safety and stabilization, including Baranowski's work. In her website, she has like videos on stabilization, like safety and stabilization, breathing, relaxation. Again, they are videos that potentially you could also play during a telehealth session with a client, and then you could do it together with the client. So that's another way also of doing that. Let me just see if there are other comments or questions I could respond to in the chat, I think. Okay. All right. All right. Now, following on with our triphasic model, now let's move to like trauma narrative processing. Once you have taught clients or coached them around different tools they can use around safety or stabilization, you can move to the next phase around trauma narrative processing. Now, when we think about trauma narrative processing, this is really where you allow clients to really tell their story, their most painful stories around like trauma. But it's good from a culturally responsive lens to really acknowledge that different cultures have different ways of like storytelling. So for example, Dolores Bigfoot, in her work with American Indian, Alaska Native, or Native American populations, right? Honoring children, mending, she calls it honoring children, mending the circle. She talks about how storytelling doesn't always need to be verbal, right? Or written. Like for some clients, they may choose to tell their story using sand trays or puppets, or through therapeutic art. They want to express it through art. Or you could use the Native American journey stick to really recount the chronology of their traumas or stories, right? As a visual way of really following their journey around their difficult experiences, right? So there are different ways of like storytelling. I also want to acknowledge that you could even integrate like cultural stories to really reinforce or model for clients that storytelling aspect of the work. So for example, like with me working with Mai, like really acknowledging, for example, that when she was growing up, her grandma, when her grandma was still alive, would often tell her like folk tales or mythological stories from Vietnam around the history of the Vietnamese people as coming from a dragon or a fairy. So a lot of those folk tales you could use to integrate them into the work that you do too around like cognitive coping. So for example, one powerful way of doing that is an evidence-based treatment called cuento therapy that is used for Latina, Latino, Latinx, or Spanish-speaking populations. The use of folk tales from Latin America could be a powerful way of really reinforcing coping ways of dealing with negative thoughts or even intense, difficult like experiences by bringing those folk tales in sessions as a way to model for client, just like in that folk tale, right? There are various ways by which you could challenge your thoughts or you could regulate your big emotions or feelings. Yeah. So the use of cultural stories could also be a powerful way of really doing this trauma narrative processing work. Why is trauma narrative important? I think here, again, in thinking about like culture, the dominant Euro-American culture or Western paradigm emphasizes that psychotherapy is built around confession. So many times we have this thinking that, well, a client cannot heal if they don't talk about it. They have to talk about it to really heal it. And for me, that's a very Euro-American, Eurocentric bias, right? That you can only heal if you talk about it. I came from an indigenous culture in the Philippines where I know that many times I and my community heal from our traumas or difficult experiences even without talking about it at all. Like we process it in other ways, through song, through dance, through music, through art, right? As a way of really processing or healing from those difficult experiences. So I want you to acknowledge that and really think about it as you're thinking about, well, I need to hear the story from my client. I need them to confess about it. But is that really necessary for them to heal? When we can think about other ways by which they can really process those difficult stories. Now, if you get to trauma narrative processing, it's good to acknowledge that it doesn't happen all in one session. Many times the process is a gradual exposure. So with clients, if they recount their stories, right, they recount their stories only up to a point that they can really tolerate it. And many times what you integrate in the work is a pendulation. And pendulation really comes from the work of somatic experiencing, wherein if you're moving from safety and stabilization to trauma narrative processing, it's not linear, but it's a pendulation. Clients would gradually recount their trauma stories, and then they may back out of it because it's hard to tolerate the pain around it. So if they have difficulties around that, then you move back to like safety and stabilization. Help them again with tools that would help them relax or regulate their difficult emotions. And once they're more regulated, then you move them again to the trauma narrative processing, like add more to their stories, right? And it's good to think about it as the process is not linear. So it's a very painful journey of really processing one's trauma narrative. And sometimes we could use like metaphors to really think through that. Like the cut metaphor from trauma focused CBT is one of them, wherein you could imagine trauma as like having a cut, right? And to really heal from that cut, you have to apply medication or do something to it, clean the wound, etc. Right? And in doing that, it's painful to do it, but it's a necessary process. And with trauma narrative processing, it's very painful to go through your trauma stories again, to re-experience them. And that's part of the journey of really, finding ways to regulate or stabilize from that pain. Another metaphor that you could use, and this comes from cuento therapy, is the cuento of tossing ice. And this is a story from Latin America wherein there was once a jaguar that used to toss his eyes into the ocean for fun, and they would be tossed right back to him. So it's a game that the jaguar plays with the ocean. And one time the jaguar was very frightened because his eyes that he tossed to the ocean did not come back because it was eaten by a shark. Well, it was really like awful, right? And so the jaguar started to get frightened. I could not see anymore and was so sad about it. And then there was this magical bird, a queen condor, came and saw that the jaguar was in trouble. And the jaguar begged the queen condor, please, please, please help me, help me get my eyes back. And I promise I will hunt for you for life. So the queen condor gave him mud and told him to put it on his eyes. And when the jaguar did it, it hurt his eyes even more to put the mud, but it was a magical mud. It hurts, it hurts. And then the queen condor said, well, just endure the pain. It's going to be okay. And after enduring the pain, magically, he opened his eyes and he was able to see again, the jaguar. And magically, it's now glowing and he could see even better. So that's just an example of like a folk tale from cuento therapy that you could use to really reinforce the fact that trauma narrative processing is a journey that would bring a lot of pain. But part of that, similar to that metaphor, to become clearer and to help you regulate better is going through that difficult process of really like trauma narrative processing. So to engage clients in the trauma narrative, most of the time, again, it is a graded approach. You can start with the facts. Clients can start with the facts. Like, can you describe when it happened, for example, if they can recount it like historically, what was happening during the day? Do you remember that day? What did it look like? What was the weather? What were you wearing that day? Who were the people around you? What is the first thing you did that day, right? Start with facts. And then part of trauma narrative, either verbal expression or written, is now adding more to the story as it becomes easier for them or they are more regulated to really invest in it, right? Trying to add like the thoughts, the feelings, even body sensations around those trauma exposures, adding more information through time and revise and add more. So it doesn't happen all in one session, right? It's a gradual process of really helping clients around holding those stories, those difficult stories around their traumas. And with kids and adolescents, again, finding creative ways of really helping them tell their stories around like traumas, using sand trays, graphic novels. They can create like comic strips out of it. Using puppetry could be another one of doing it. Yeah. I used to work in New Zealand with Maori populations, and we run a group for tattoos. And tattoo, or in the Maori tradition, it's called tamoko, is a Polynesian cultural aspect of tattooing to tell stories about your life. And sometimes in those stories could include like distressing or stressful stories or trauma-inducing stories or traumatic stories. So for example, here, symbolizing the use of rain clouds to symbolize dark periods in their life. And it could include like trauma stories is part of telling their stories using tattoos or body art. In Japan, they have the use of like manga or the use of comic strips to tell stories around one's mental health. It could be traumas or other presentations. So for example, Yoshiko Okuyama talked about the use of manga as a mental health tool. to help clients tell their stories, their most difficult stories about OCD, depression, or even like traumas, right? For younger kids, it's good to also create for them like ways of modeling how to tell a story. So you might integrate like bibliotherapy in the beginning to help model for them how to tell a story, right? And particular stories can serve like as a catalyst for them to really see themselves in the characters in the story and identify with them. So your work as a clinician is to find stories that might include experiences that are close to the experiences of your clients. So, for example, a terrible thing happened can talk about stories of trauma. It doesn't mention what's the terrible thing that happened in the story, but it then creates like an avenue for identification for a client, right? Wherein, oh, I'm just like that raccoon, something terrible happened to me. And that's the way they can start processing some of their trauma narratives. And with the stories, like if you're in a telehealth environment, you can even look in YouTube, because many times some of the books could have a read aloud, and you could just play the story in a telehealth session. Both you and the client can listen to it, or even sometimes some authors read aloud those books in YouTube, and the author themselves, would read the story. Sometimes kids have fun listening. Oh, so that's the author. I really love this story. And they like seeing that sometimes in telehealth sessions. I would also recommend you going to like Piplo Productions. Piplo Productions, let me just go to their website right now, is a wonderful organization that has created books for kids available as hard copies or digital forms that were meant to really supplement or complement mental health treatment or mental health work with clients. And some of those stories are really meant to highlight or capture some of the difficult stories of clients around anxiety, around their fears, around like traumas or stressful events in their life. So if I click on the story section, for example, here, stories around, you see here, depression, experiences of sadness and anger. Let me scroll down. Stories about fears and even like traumas. I love this story a lot. I've used it a lot with clients. Once I was very scared. Talks about something happened in the forest, and the different animals in the forest had different ways of coping or even responding to that experience, right? And it has been translated into so many languages. So depending on the language of choice as well of your client, you could find like different language translations of the story. It could be purchased as a hard copy, but if you go to the actual story, it has free digital forms of it. So you could, in a telehealth session with a client, you could just screen share and then read the story together, right? There are free PDF versions of the story. There is even like a read aloud of the story by the authors of the story. So you could play that from YouTube, you could play it there, and you and your client can just listen to the story. And it has guidelines on how to process the story with a client in a way that you are making it therapeutic as a story for them. It also comes with digital tools that you could use with clients, right? In terms of finger puppets, they can print it in their home, and then you can recount the story together. They have even there like a feeling chart for helping clients to really try to find, from all the animals in that forest, who do they identify with the most, right? When they have like a stressful experience, do they become angry like the dog, or do they become like surprised like some of the other animals in that forest? It's a way of really finding ways for a client to identify with the characters of the story and help them process some of those difficult or stressful experiences. So you could find more in that. Piplo Productions is one site I use a lot digitally and also in person with especially like younger clients to help them around that bibliotherapy. Yeah. I got here a message about it can be re-traumatizing in some cases to talk about trauma. That's right, right? And that's part of really holding the work in a graded way, right? So as clients get re-traumatized by recounting their stories around like trauma, right? Finding ways to go back to phase one, right? When they get dysregulated about recounting those stories, how do you help them bring them back to regulation? Through somatic management exercises, through grounding, through mindfulness, through when they are re-traumatized, what thoughts come to their mind, or what feelings or strong emotions are coming up for them, and then help them regulate around those before you move them back to recounting those trauma narratives or trauma stories. If you're working with BIPOC clients, it's also important to integrate like racial and ethnic socialization into the work that you do. So looking for storybooks that really capture experiences of racism, or even those that really strengthen racial or cultural pride. So for example, going with the teachings of Ibram Kendi, and also developmental experts in the field talk about, when do you start really having racial conversations or conversations about diversity with clients? Well, kids become aware of differences around like color or race or ethnicity as early as 3 months. So you can start racial socialization as early as 3 months. Even with Ibram Kendi, he has this board book called Anti-Racist Baby, which could be useful for kids as early as like 3 months, like a board book or like a picture book. You could start having, those coaching, teaching moments with kids around racial, cultural pride. So that should be part of the work that you should also be integrating, especially if you're working with BIPOC clients. This one was created by teachers early on the pandemic. It's called Black Lives Matter Reading Room. You could Google it. You could immediately find this Google platform, this Google page on Black Lives Matter Reading Room. And then when you click on the different books, it launches like a read aloud from YouTube. And it's been a while, so some of them don't work anymore, but I'm sure if you look in YouTube, you could easily find a read aloud version of some of the books that really reinforce this racial or ethnic socialization around developing racial or cultural pride, but at the same time also really processing with clients difficult traumatic experiences around racism or even like microaggressions. When we think about trauma narrative, it's good to reinforce that trauma narratives are not linear, wherein they come as stories with an orderly beginning, middle, and an end. A key symptom of trauma is dissociation, and that's fragmentation. And that fragmentation also appears in the way clients tell their stories. So many times for them, or for clients who are traumatized, their stories don't come as a linear way, but they come in fragments, right? Like if you ask them to recount certain stories around their trauma, sometimes they might say something like, I don't remember much about it, of what happened, but I remember the smell, or I remember just a flash of something that happened. And they're still really finding the memory of that trauma. Because part of what trauma experts talk about is many times the access to the verbal aspect of the memory could be very difficult. And part of one's defense mechanism or survival mechanism is to really repress that trauma memory. So many times clients cannot recount it. And when they are beginning to recount that story, the memories come as like fragments, as isolated images, sounds, or even like body sensations. I just remember what I felt during that day, like dread, or I was so scared during that day. I just remember I was crying when that happened, but I don't remember anymore what happened, right? So it's good to really think about, when you're helping clients really process those fragments to help them gather it. And your role as a clinician is almost, as they're doing it, really creating like guardrails for them. So as they're going through this difficult process of like trauma narrative processing, they don't fall off the cliff and become even more dysregulated or re-traumatized. So the essence of creating guardrails is really bringing back those somatic management, those safety and stabilization tools to help regulate them as they are recounting those fragments of those stories. One digital tool that I use a lot with clients, this is something I learned from teachers, is Storybird. Storybird is a platform used by teachers, by many teachers, to help clients to help students tell stories. So with Storybird, it gives you the option of telling stories through a process first of like visuals. Sometimes students may have like, are in a blank on terms of like, yeah, I'm thinking of a story, but I cannot put it yet in words, right? They may start with pictures, right? And Storyboard has like a bank of pictures. Are there pictures that could represent what story you want to tell? So they can start with pictures, right? They can choose pictures. Oh yeah, this picture perfectly captures what the story I wanted to tell. And they could bring that picture into the platform. Then later on, after pictures, they can move to the next phase of like, now are there certain words that you could use to capture your story? So don't think of sentences yet. Don't think of paragraphs. I want you to start with, are there words that could describe your story? It could be factual words, when it happened. Is there a setting for your story, right? What's the climate or the weather during that day where your story happened, when your story happened, right? Are there words to capture about your characters? So they can start with words. It could just be a hodgepodge of words that they throw into the platform. And then later on, once they have the words, now they go to the next phase. Now I want you to put those words in like sentences or like phrases first. And then gradually, let's form like paragraphs out of those words, phrases, and like sentences to come along with the pictures that you have chosen to tell your story. Right? So for me, it's a wonderful program of that graded approach to narrative processing, which you could also use for clients who have been trauma exposed. So if they cannot recount the story, certain images might help them remember those stories of those painful experiences. Oh yeah, that event that happened to me, it was dark. And they could choose images that really capture or symbolize that darkness of that experience, right? And they could choose pictures to start with. And then later on, they put words, facts first. And then later on, thoughts, emotions, body sensations, words that could capture that. And then gradually form them into sentences, phrases, and then later on, full narratives. And it's really moving them from that fragmented story to slowly towards a more coherent story of like verbal processing of their trauma. It's good, again, reminder from Bruce Perry, right? Use the 3 R's model. If clients are not ready to recount their stories in verbal form, reasoning, to write about it or talk about it, again, scale back, a bottom-up approach. Help them regulate first, help them use expressive arts to tell their story, even without verbally processing it yet. So in terms of the limbic system, helping them with expressive art to tell their stories, you could use a variety of like therapeutic art, right? Sometimes for clients, even with telehealth, what I do, there is really meaningful value in terms of really using actual therapeutic art tools, paint, pencils, colored pencils, markers, clay, Play-Doh, slime, etc., to really engage in it. So I know that could be very limited if you're doing like telehealth, but what I do is I send materials to clients. I send an envelope to them before each session containing like little bits of materials that I want them to use during a telehealth session and would keep them engaged. But what I usually tell them is, don't open the envelope until our actual session. So once I open the telehealth session, then I ask them, remember the envelope I sent you? Did you receive it? Now I want you to open the envelope. So now they can engage in therapeutic art using actual materials. But if you're not able to do that, feel free to also use digital ways of doing like therapeutic art. I use Canva a lot, which is a good platform for using different art materials, even using like images. It even has AI in it, wherein they could just create images generated by AI based on what they're thinking around the stories our clients wanted to tell. And Canva also has like really good templates already. Like, for example, you're asking them to tell stories about their support system. They have like pre-made eco maps that you could use with clients to help them identify who is in your safety net or in your support system. And Canva has that. Or, you could also use like digital art or therapeutic art tools. And these are 2 examples. They are in your slides that you could explore. Or if you're using Zoom or any other video telehealth platform, you could just use the whiteboard. And clients could use the tools there to draw or to even paint in a digital way their story. It's important to remember that if in keeping with this triphasic model, right, when you are processing therapeutic art with clients, so once they have completed, their art expression and you want to process it with them. Many times as clinicians, we're always tempted to ask questions that immediately appeal to reason. Like, what does it mean? Like, what are you trying to tell from your story, right? And Linda Chapman really has a beautiful way of really encouraging clinicians to first have a dialogue with the image with their clients. And that is asking questions that are more directed around the limbic system. So really focusing on the image first. If the image were to tell something to you, what is it saying to you right now, right? So that brings it in a limbic system form rather than delving immediately to appealing to reason. So it's just really having a dialogue with the image, right? If the image or the different parts of your image would talk to each other, what are they saying to each other? That's really a good way for really thinking as well about the imagery. I'm showing here other ways of really doing the trauma narrative processing as well, using Tree of Life. That is found in your site as well, like really representing the story of your life via a tree could be one way to also process trauma narrative stories. So using the tree, it's not just the trauma stories, but also talking about one's coping mechanisms, one's family of origin, what are your roots, right? And then talking about one's storms, what are the challenges that came to your life? So that are trying to knock down the tree. So in there comes the stories around like trauma or any stressful event that are challenging for clients. And you could also do this, of course, in digital form, using a whiteboard, asking clients to draw a tree, and using that as a way to really process the trauma narrative. Yeah. Stories is an evidence-based practice created by Dr. Megan Corrado. She used this intervention primarily for inner city youth who are mostly Black, African American, and Latino, Latinx. And her vision is really to make the practice of trauma narrative processing culturally responsive by asking clients to really integrate expressive arts into the way they tell their traumas, right? And I won't play the video, but you could go to her YouTube channel and also her website. She has their videos introducing this particular model or modality of stories. Yeah. Now, I wanted to go before an activity that I would give you. Another way of telling stories that I use a lot with clients is Sandtray, right? And we know, based on the work of Dorokoff and also Jungian psychotherapy, right, the powerful ways of really symbolizing one's experience rather than just talking about it could be healing in itself, wherein you ask clients to create their world, and their world could include some of their trauma stories, right? In a way wherein you don't ask them first to verbalize about it, but quietly you are there as like a quiet witness of them telling their stories in the sand. They would use like miniatures to represent their stories by creating their world. And then later on, you move them to processing what is going on in your story, right? Asking like cognitive-based questions to help them process what they created in the sand tray. And following the triphasic model, right? That narrative processing is really processing in the limbic area first before you move to appealing to reason, like asking clients questions about, can you tell me the story that you created in the sand? What's going on with this character or this character? What are they saying to each other in your story? When you go to that conversational aspect, that's really the cortex that can come later. But first, you have to stay in the aspect of really just allowing clients to quietly tell their story non-verbally. Yeah. This might be a typical Sandtray setup if you're doing things in person, or if you're visiting clients in their homes, you might just use like a shoebox, like a Sandtray, and then give them access to some miniatures that they could use in their storytelling. You can even use like the Sandtray as a way to do assessments. One of them that I use is creating genograms in the sand with clients. I'll give an example on how potentially you could do it digitally. Like, for example, in this one, again, not a real client, but in here, the client becomes the director of the Sandtray process. So I have the Sandtray materials with the miniatures, and I ask a client to create a genogram of their family by using miniatures to represent their family members.
Oh, right next to you? Okay. Now, who else is in your family?
My mom and my dad.
Okay, who would you want to be your mom?
The cheetah and my dad is the tiger.
Okay, where would you want me to put mom cheetah?
Next to sister, and then dad should be right next to mom, and then my two cats.
Your two cats. Now with your two cats, what miniature? I don't have cats, unfortunately. Sorry about that. But is there any? Is there any miniature? Oh, seals. Yeah, I have seals. I have two seals. There you go. Now where would you want me to put the seals?
Next to me. One
next to you.
And then the other one there, yeah.
Okay.
Okay.
So that's just an example. Of course, you could see the limitation of that. The client is not actually engaging with the materials, but just directing you in a telehealth session. So that was during the beginning of the pandemic when I was trying to find ways of really creatively still using Santray, but in a video session with the client. Then later on, of course, came the evolution of so many virtual platforms of digitally using Santray. One of them is the online Santray by Dr. Karen Fried. So the link is in the slides, but just to show you a little bit about this platform, let me just go to this platform very quickly. Yeah, if you go to Oaklander Training, there's a section there on tools and resources. One of them is the online Santray. So in here, there's just a picture of a Santray. And then on the left, you could see here like a library of like images that a client could use, like miniatures to represent their experiences. So for example, if they want to use a Loch Ness monster in their story, if they click on it, it appears on the digital Santray in here. And they could use that as part of their story. They could make it move. They could add other figures in it. They can increase the size. They can copy it and duplicate it, etc. And then they could save it once they have created the picture. And then before you process with them, then they could have like a saved version of the picture that they create in their Santray. So that's one version you could use. Another one are virtual dynamic versions that you could use. Virtual Santray is one of them. I won't show you this one, but the one that I'll show you is a similar one. It's also a dynamic one called Simply Sandplay. And what I like about this, especially for teenagers and older kids, it's like a video game. So a lot of kids who love video gaming may find this very engaging because all the miniatures there move and they can enter a world similar to how they would do it in video games like Fortnite or Minecraft or Sims or many other video games wherein they create a world. So Simply Sandplay simulated that in a way that the client can create their world in this digital Santray version. So for the question in the chat around what are other ways even for teenagers to help them open up about their stories, there's one expressive art ways to do that. So instead of just talking about it or writing about it, finding like expressive arts way for them to, you know, if it's really difficult for you to tell that story verbally, let's try, you know, this digital Santray for you to tell your story. So for this one, it looks something like this. And then after this, I would engage you in an exercise. So in here, Simply Sandplay, I would give you the code later on. It's a 24-hour code, just in case you want to do this activity outside this training after today, but it's only good for like 24 hours. So the use of the code is really if you want your client to also do it outside your session. And many of my clients often like the code, oh, I want to continue doing this, you know, after we say goodbye today. And you could give them the code. And the code for the day, you just enter it in here. I will give it to you later on in the chat, so don't worry about it. And then you log in. When you play, the Santray looks like this. And in here, you find here a treasure chest that would give you the digital miniatures that a client can use. So for example, they could find a variety of like animals they could use. So for example, for me, I would want to add like a dinosaur in it. And you could increase the size, you could rotate it. You could see the dinosaur is actually moving, right? You could use objects from nature. For example, if you want to add like trees, you know, if they want to add trees in their stories, or they want to add forces of nature, like, for example, rain, they could add like a rain cloud. So it's a very good alternative, and there's actually rain in there, you know, that clients could use. They could create, you know, let's see, oops. like grass, or if they want to add water, they could also add water in their sand tray, for example, and it could create like water around it. Okay. So what I'll do right now is to just give you an experiential activity to practice on the use of this like sand tray tools. And potentially you could also think about using it with actual clients. So what I'll do right now is I'll put the prompt in the chat, and you will be put in like breakout rooms, right? And the first part of the activity is done individually first. You could do it individually for the first 6 minutes, but you will be in the breakout rooms already just so you could support each other, talk with your partner or partners, because you will be put into groups of 3 around the platform, and you could also help each other in terms of navigating the platform. You go to that link. I think I showed you already that site. And what you do is scroll down to the center of it. So you get to that link, scroll down to the center, and what you'll find there is, let me just quit the game. Something like this, a welcome page. And the code for the day is, it's right there, X lowercase 10, 10, and then lowercase I, K. Just enter that here where it says password, and then log in, and then click play. And then now you have access to the digital sand tray platform. Now, if that's too dysregulating or discombobulating, I also put a link at the bottom of the alternative platform from Karen Fried, where it just uses like images. You click on it, and then the image would populate on the sand tray picture. Yeah. So the first prompt is, for the first 6 minutes, once you're in your breakout rooms, just create your world right now. How is it for you right now? Symbolize your world right now using different images. And for the last 4 minutes, process it with your partner or in your small group. What was your experience like creating your world digitally? Yeah. And then after that, after 10 minutes, we'll bring it back to the main room and then process it a little bit. Okay. Oh, sorry about that, Melissa. Try to see if the other website is not blocked, like the static one, the one from onlinesandtray.com with Karen Fried. The code again, it's there in the chat, but I will enter it one more time. It's X lowercase 10, and then I lowercase k, lowercase k. Oh, it's that one. Enter the passcode. Oh, sorry. There you go. Thanks, Diane, for entering for folks. And thanks, Leslie, too, for answering that. Okay. So now you could go to your breakout rooms. I hope Leslie was able to. Yep, there you go. So join your breakout room, and I'll see you in a little bit.
Hi all, seems we have a few folks that are not able to join the Zoom room. So if you have any difficulties, please chat us in or chat directly to the CTech admin. So just a reminder to folks, if you are able to attend the or join the breakout rooms, you should see something pop up on your screen. If not, on the bottom toolbar, you might have some sort of indication. If you click on that, it should bring you to a breakout room that you can click on and automatically transfer you there. So you do have to manually accept in order to join the breakout room. Richie, do we want to send in a time check for folks? You want Leslie to do that just so that folks have a minute of
Sure.
advance of
I
when
would
the
just broadcast it probably
okay, you
6
can do
more
that. Great.
minutes. Yeah, I could do that.
Okay. Only suggesting because I know we just have 20 minutes left. So
Yes,
just want
that's right. Yeah.
a
And
little
I will
organized.
finish up in 5 minutes once they come back. And after that, I'll just open it for Q&A if there are. And then I would leave you the 5 minutes, last 5 minutes.
Okay, yeah, we haven't had that many questions in, so maybe there'll be some questions coming in from the activity here.
From the activity, that's right.
Yeah, the few questions that have come in, I believe you have answered throughout the presentation. So thank you for that.
That's right. No problem at all.
Thanks, guys.
Okay, welcome back, everyone. I'm not sure if everyone already is back in the room, but let me check. Oh, I think they're still coming back. Okay. I think folks are back. Welcome back, everyone. So just in terms of the time, we may not have enough time to process the activity, but feel free to share some thoughts, any questions you have in the chat as well. Hopefully that gave you just a sneak peek of what a virtual sanctuary might look like, like in a telehealth environment, and what other options you might use when you're thinking about using sanctuary. That probably for some of you do it mostly in person, but thinking of digital ways to do that with clients. But for this last section, before I open it for a Q&A, is just to highlight some interventions I use for right? I integrated a couple of interventions or evidence-based practices. One of them is trauma-focused CBT. And with trauma-focused CBT, you could follow the work of Dr. Reagan Stewart, where she did a lot of tele-adaptations of trauma-focused CBT in terms of digital worksheets, or how do you process the trauma narrative in a telehealth environment? How do you create digital versions of games that often you use around the somatic management aspect of trauma-focused CBT? And then trauma-focused CBT with Dr. Reagan Stewart's leadership created a resource website on doing telehealth for trauma-focused CBT. And the link is going to be in your slide. And if you go to that actual website, it looks something like this: resources for implementing trauma-focused CBT via telehealth, tools, videos that you could integrate during a telehealth session, how to process the trauma narrative using digital versions of like worksheets or manuals or handbooks. It's available in English, and also this section on recursos en español if you have Spanish-speaking clients who would benefit from Spanish translated versions of these digital tools. So that's one. And also I also use narrative exposure therapy, which is not so popular in the US, but more in European countries, in Africa, and also in Asia. Wherein what I like about narrative exposure therapy is it doesn't only hold with clients their trauma stories, but also their life story. So really for this model, you help clients not just tell their stories about trauma, but their entire life story. They construct a lifeline using a rope and using, flowers, for example, to symbolize pleasant or major events in their life, and then rocks or pebbles to symbolize sad, fearful, and traumatic events. And they create it like chronologically using Post-its or index cards or paper to really label each of those flowers or rocks to symbolize their happy major events or sad, fearful, and traumatic events. And the whole process of narrative exposure therapy is to allow clients to tell all those stories across many different sessions, right? Not just their trauma stories. And it's good to really enforce that, your story, it's a more holistic approach of really looking at stories, that you are not your trauma stories, but you have a full life story, and trauma stories are just part of that. So for this was an example of a digital way we did that. Using whiteboard, we just share live sand tray, work with me. And so we use like a rope to symbolize the sand tray, a rope image in the sand tray, rocks to symbolize difficult experiences. She used a candle to symbolize grandma's passing away. And, the beautiful events in her life, she symbolized with like roses, right? COVID was like a rock for her because it included a lot of stressful events in her life. So this is the way we digitally did this lifeline or story. Again, you are not your trauma. So with narrative exposure therapy, I really just appreciated, the use of like storytelling across all one's life stories. Yeah. So the last thing I want to show is really, again, if the kids or teenagers that you work with are very savvy about apps, you could review apps first before using them with clients. For trauma work, there are a lot of apps that could supplement your evidence-based work that was created by the VA, and they are all for free. So for example, if you're using adolescent versions of cognitive processing therapy or even prolonged exposure therapy, there are apps for that. So clients don't have to write down their cognitive errors or maladaptive thoughts around their traumas on paper, but they can do it like digitally. You know, like with cognitive processing therapy, like thinking about thoughts that keep clients stuck. They could have a digital stuck point log to put, you know, on that log thoughts that keep them stuck or events that keep them stuck or emotions that keep them stuck in their life in a digital way using an app. So feel free to explore those. Now, as a way to really finalize my presentation, this is just a good reminder that trauma healing has many different layers, right? You could really work with clients so they can heal on their own. And this comes from Resma Mannequin, but themselves are not enough to heal in their traumas. They need healing with another trusted, caring person. It could be their parents, their caregivers, their friends, other support individuals. With you as a trauma therapist or a trauma clinician, healing in community, healing with the help of a body-focused healing professional sometimes could be helpful for clients, you know, working with a yoga teacher to help them with body-based ways of really healing their body using yoga, you know, or a Tai Chi teacher to coach them on Tai Chi movements to help them regulate their bodies or help them calm their brainstem, right? So healing with the help of a body-focused professional. So that's all part of healing, and they are all interdependent with each other. This is just an example of a virtual treatment plan I use with Mai to really capture the different activities and interventions we've used all throughout our treatment that follows that triphasic model, right? Different virtual tools to help her with safety and stabilization, moving on into how she told her stories around her traumas, using sand tray, using the fear ladder to really reinforce that it's a graded approach to really telling your stories around like trauma. And just a couple more resources before I open it for, you know, a few questions that you may have. Again, the TIPS website, if you go to that, there is actually there a section on trauma healing, which would include all the tools or some of the tools I've already highlighted today. And last in part one around safety and stabilization, and also around trauma stories processing. But there's also a handout or a tool resource that I collaborated with CTAC, and they will share that to you in the chat or after this training, just to summarize all the key elements of best practices around trauma-informed, trauma-responsive care, including links to websites you could access to help you in your telehealth work. Okay. And Leslie, I wonder if you could help me put that link in the chat for folks to start exploring. But again, that will also be sent to you after this training. So now for a few minutes before we close out, I just want to see if there are questions in the chat that I could potentially address.
Yes, so thank you so much, Dr. Rubio. Again, I will remind folks this was a one part of last year. It really became 2 parts now, just to really give you a little bit more opportunity to implement some of the tools. So I know you had that implementation plan. We checked in with you in terms of any challenges or what went well. And then additional topics were covered. So I do want to open it up. I know there was a couple of questions that came in, but Dr. Rubio, you answered those live and in person. But again, want to just open it up to folks if there's any questions that you might all have. I did see that there was something about getting a list of resources. And as you mentioned, Dr. Rubio, we are looking to put in that link. I did see that just it's popped up there. So I do encourage you to take a look at that. But any questions that folks might have from either this training or the last training, just want to give folks a little bit of time. Questions? Let's see. All right. So if I know that there's a lot of thank yous now coming in. There is a brief survey that has popped up on your link. So if it's not there, please certainly scroll up. Again, if you can take the time to fill it out, it just will take a minute or two. Will also pop up as you close out. But we do take a look at these very closely. Dr. Rubio, myself, and other folks on the team did spend time trying to see how we could revise it. So please, again, complete that survey. The link is in the chat box and will also pop up for you. Again, I'm seeing a lot of thank yous, very insightful. I will say I don't personally have kids. I have nieces and nephews, and I think some of these things have been really great in terms of how to really engage folks. And before I kind of go over our upcoming events, I do see that there's a hand up, Timothy. Let's see.
Yeah, I was curious if the courts have seen this approach. There's a few things that I liked about it. First of all, I think that the process, the painstaking process that you described about how you have to create symbolization for things that are unsymbolized, and that is actually consistent with a psychoanalyst by the name of Wilfred Bion. I don't know if you're familiar with him, Doctor.
Word, yes.
Yeah, well, I tuned into it immediately, and you are right on the money, you know, because the key with psychoanalytic approach to children is to take the children's perception based on their own developmental tools that they're in their achievements. And even with adults, if there's a traumatic experience, there's no words because it's beyond what we would consider our human experience, things that we would normally expect to have in our lives. And so what we have to do is step by step, painstakingly create these symbols so that children can apply words, sentences, paragraphs, narratives. And you did it wonderfully. And as an attorney who functions in the family courts often, I'm sitting here thinking, boy, you would be someone who I would call as a witness, you know, if you were seeing one of my clients, if I was a guardian. And I just want to congratulate you. That's wonderful. You did.
Appreciate that. Yeah, thank you so much, Attorney Roldan, for that. And really, also really appreciate what you mentioned. And I think courts could really benefit from it because sometimes, of course, there's a motivation we just want to hear the story. And that's not the most trauma responsive in a form that they would just expect sometimes clients, children or teenagers to just tell the story, what happened. And that's not very trauma responsive because you're right. There's a developmentally appropriate way to really hold that story that is trauma responsive for those kids. Thank you.
Thank you so much for sharing, Timothy. Yes, I mean, if we can have you present on and on, Dr. Rubio, I think that would be great. So again, I do thank you for taking the time and collaborating with us again. Again, you know, we're seeing a lot of thank yous, really great valuable information and resources. As a reminder to folks, we will have the trainings and the resource posted on our CTEC guide. And on our following slide, I did just want to call attention to our upcoming events. Tomorrow, actually, we have a fire setting and violent behavior risk assessment with youth and families. We are seeing that there is a push, at least in New York State, to really assess for certain situations, certain behaviors. So again, tomorrow there will be one on fire setting and violent behavior. So certainly encourage you to join. And I did also want to highlight that we do have these things called playlists. It is really just a collection of some of our previous offerings, but they really tie in a lot of topic specific offerings. So the recent one that we sent out, I believe it was actually just this month, if not the month beforehand, is supporting neurodiversity among children and adolescents. So again, you can go to our CTAG webpage under trainings, click on playlists, and you'll have all of the associated offerings curated there for you. And on our very last slide here, I do want to again say thank you to Dr. Ritchie Rubio for such an informative and enlightening presentation. I want to say thank you to you, our audience members, for your participation, as well as all of your comments and chat-ins. And again, as a reminder, please visit our website for any past trainings, events, resources. You will be receiving again in 2 to 3 days a detailed email with instructions for CEs if you are eligible. Any questions, please reach out to us. And again, 2 to 3 days as well for the posting of the slides and resource that was shared via our chat. But again, any questions, please feel free to reach out to us at ctec.info@nyu.edu. And with that, again, Dr. Ritchie Rubio, and thank you again to all the audience members. On behalf of CTAC, have a great, wonderful rest of your day.